Well, hello once again, everyone. My name is John Leatherman. Welcome to our CAPE training program. I'd also like to acknowledge my close partners in this project, Mark Skidmore from Michigan State University, Rosa Solis McKelvey from Michigan State University, and Paula Miller, our CAPE postdoctoral fellow, all associated with the North Central Regional Center for Rural Development. Once again, our CAPE program, Community Assessment and Education to Promote Behavioral Health Planning and Education, is a co-sponsored project involving the Substance Abuse and Mental Health Services Administration, the U.S. Department of Agriculture, as well as the USDA Regional Rural Development Centers. The partnership is intended to identify and disseminate more effective response strategies to the challenges of mental illness and substance abuse within our communities. Our program has two primary objectives: to enhance behavioral health literacy, as well as create and sustain community coalitions to address behavioral health challenges. We've made considerable progress on the first objective already. At this point, you participated in the Mental Health First Aid Training Program. We've had a webinar to discuss how we might utilize that information in both our personal and professional lives. And now we're going to switch gears and move into the second major objective of our program, the idea of creating and sustaining community coalitions to address behavioral health challenges. We're going to be going through a series of webinars that discuss the idea of organizing and sustaining community scale initiatives. The principles and activities that we will discuss can be applied to really any community initiative, but what we're asking you to do is consider them in relation to the behavioral health challenges you see in your community. You may already know much of what we'll be discussing in our next couple of meetings. Some of it is intuitive, some of it you've learned on your own, but what we're trying to do is pull this all together so that you can apply it to the issue of community behavioral health and hopefully increase the probability of success in whatever your endeavor may be. I think that there's a good chance, though, that you'll learn a few new and valuable things along the way to apply in your work. Now, here in our CAPE training program, we're at the community needs assessment portion we'll be discussing today. We've already covered the introduction and overview, the mental health first aid program. The next three sections of our training program deal with the community development component of our program. In session number 6, that's actually your session where you present your plans and ideas on the initiatives that you'd like to undertake within your community. Thereafter, we'll take a brief break of approximately 6 months, and then we'll get back together and check in to see how you are doing and how we might be able to bolster your efforts. In this particular session, we're going to talk a bit about how local leaders access health-related information to establish the priorities that they believe exist within the community, and we'll focus primarily on secondary data that's available that can help you to assess the behavioral health issues that exist within your community. We'll talk about how to utilize that data to create effective communication strategies and graphics, and finally, we'll wrap up. In our next segment, we'll be discussing primary data collection that is intended to complement our presentation here today. First of all, considering how community leaders access health-related information and form their views of what the important issues and priorities are. And from here, I'm drawing on earlier work that we've done with the CAPE program. We've actually gone through several rounds of various types of community pilot programs, and we did one here in the state of Kansas, in Finney County, Kansas. That's the home of Garden City. It's a very rural, agriculturally dependent area in southwest Kansas. A lot of cattle production, meat packing going on. It's a majority Hispanic population in that portion of the state, a very young, vibrant, family-oriented, and low-income area of the state. Well, we surveyed community leaders and indeed surveyed approximately 250 of them and had better than a 50% response rate in asking them about where they get their health-related information. We actually looked at 4 different groups of community leaders: health services, social services, community organizations, as well as elected and government officials, and asked them what they saw as the problems and issues that existed in Garden City, as well as how they obtained information and formulated their views about that. There was general agreement on what the important priority issues were within Garden City. Alcohol abuse, drug use, teen pregnancy were the principal ones. And indeed, we noted that in general, there was perhaps some greater sense of intensity among the health services professionals, as you might imagine, who seemed to be focusing more on issues relating to treatment and human services, whereas the elected officials, the government officials, the organizational leaders focused more on law and order kinds of considerations, as well as public services that were required to address those needs. Overall, the principal areas that they focused on by way of accessing information, the clientele and stakeholders that they were dealing with, as well as state government data. What was fairly interesting is that the leaders used different sources of data to formulate their views and opinions about the priorities within the community. The health services leaders utilized state agency statistics. The elected officials utilized their local government agency sources. Social services utilized their clientele and stakeholders to obtain information about local needs, and the community organizational leaders utilized local media to obtain their information. In general, we concluded that the community leaders do not really access and utilize government data resources. In general, they need intermediaries like extension agents to help to access and package the information and interpret the meaning behind the information. The important point to take from that, I think, is that we need to utilize the resources that the leaders are looking to, and we need to talk in terms of their concerns and issues with regard to the conditions within the community that may need addressing. Now, turning our attention to some of the secondary data resources that are available, this is our CAPE website. You can access it at www.healthbench.info, and you will find a plethora of information and resources available at that site. We have to give special credit to Courtney Cuthbertson from Michigan State University, who put in innumerable hours identifying the resources that you'll find at this website. And indeed, we've aggregated a host of data resources relating to behavioral health, as well as databases of programs and interventions, public studies and health data sets, general tools and guides for addressing community health, as well as guides to determine what is evidence-based interventions. And I'm not going to try to go through all of them. You will find page after page. I'll just simply summarize some of the information that's there and how you might be able to use it. In general, when we're talking about community behavioral health data, community is synonymous with county. That is the way most government data is aggregated at a county scale. And we note that virtually all of it is survey-based. Days where we can conduct complete censuses are past, and so we're always dealing with certain limitations, certain confidence intervals or margins of error in and around the estimates that we will find there. I would suggest that my own take on the data resources that are available to support behavioral health, there is perhaps more data than you might imagine, and there is also less data than you might think. Most of the data that's available comes from the Center for Disease Control's Behavioral Risk Factor Surveillance System, and indeed everyone seems to access and repackage that in some fashion. It's the most comprehensive survey of the American public with regard to behavioral health. Other important sources of data that are available in your state will be your state vital statistics, or perhaps you'll have a health informatics section within your state government. That is another source, important source of data that's available. And then beyond that, there are certain state-specific sources that you may be able to access and do a pretty nice job in and around various topics relating to behavioral health. Here in the state of Kansas, our Kansas Health Foundation, working together with the Kansas Hospital Association, has put together some very nice data resources that can support community planning in relation to health-related issues. There's a great variability in the accessibility of the data insofar as different entities make it more or less accessible. You will find it in virtually every form. In some cases, you will find that it's available in Excel spreadsheet form, very easy to work with. In other cases, it'll be in some sort of a statistical program that you'll need to have specialized capacity to be able to access. And in other cases, you'll simply find PDF files that are very difficult to work with because you'll need to transfer all the data. In general, I would say that there is more information available about topics in relation to adult depression, alcohol abuse, tobacco use, sexually transmitted diseases, teen pregnancies, and a host of information relating to Medicare beneficiaries. There are other important areas where there is virtually little, if any, local data available, things relating to local mental health, local substance abuse, local abuse and neglect kinds of concerns, all of which are important issues within our community, but unfortunately, there's very little data to support understanding exactly what is available. Once again, that's just a very brief rundown of some of the secondary data resources that we have compiled for your use in working with behavioral health challenges. I encourage you to, once again, visit the CAPE website at healthbench.info. And spend some time there. There are some significant and very important resources that are available for your use. Once we have the data that we would like to communicate to our community leaders, it's really a matter then of creating effective ways of communicating that information, and frequently that will be in graphical form. First of all, just a few principles that I recommend as I work with data. We in the university tend to love data and never get quite enough of it, but we have to recognize that not everyone is as interested, as data literate as perhaps we have learned to become, and therefore it is very, very important to be able to communicate that very quickly, very clearly, what I do in considering data, and indeed I have been guilty in the past of compiling virtual books of data and tables and so forth. Well, that's not the most effective way to communicate what is important. And indeed, what I have come to learn is that there are a few principles that I consider as I select and use the data that I am presenting to my audience. For every piece of data, I ask myself a series of questions. What it is, why it's important, and how will you use this information? If I cannot answer all three of those questions with regard to a specific piece of data, I don't use it. And then finally, I also identify where it came from. People need to know the credibility of the source material that we are presenting. So what it is, why it's important, and how to use the information. in general, I think it's also important to create some type of a reference. If we're looking at local data, it frequently is very helpful to compare that with a state level value or a national value, or perhaps a value for similar places to the ones that we are considering. A reference is extremely helpful in interpreting the information. And once again, going back to the notion of virtually everything being survey-based, unfortunately for many smaller rural areas, the data estimates are either unavailable or frequently aggregated with other similar places, and we have to make some judgment as to how well that number reflects what we believe is a situation within our community. As we consider principles of creating graphics, indeed, what we need to start with is we need to presume fairly low levels of data literacy, and we need to keep our displays as simple and straightforward as possible with clear labeling. And finally, an individual looking at our graphics needs to be able to capture its essential point within a matter of seconds. And indeed, if they have to work too hard to be able to discern the meaning in the graphical presentation, chances are they won't. And so I'd like to share with you one resource that's available. You'll find this at the CAPE website. This is a very nice guidebook to creating all of the graphics that we're about to look at. And indeed, this is something that Courtney Cuthbertson and some of our other partners at Michigan State University put together. And what you will find in there is essentially the guts of how to create graphics within an Excel spreadsheet. Excel spreadsheet is a very powerful tool for graphical representation, but it can be a challenge to learn how to utilize it as effectively as we might like. And this guidebook will take you step by step through all of the processes necessary to create all of the types of graphics that I'm about to share with you. Now, first of all, and most simply perhaps, are bar charts, and that is typically when you have two data points. Here is an example of one that essentially compares the local area to reference points, both the state and national references, and that is a useful way to communicate data when there is fairly limited data available, perhaps for only 2 points in time. Trend lines are very good for changing conditions, and once again, if you have multiple years of data that you can look at and consider how things are changing over time, we would recommend utilizing some sort of a trend line graphic, and once again, including some sort of a reference point. And in this particular case, you can see the overall local trend and what is happening with regard to changing conditions. This is called a speedometer graph. It's actually a type of graphic that people tend to like. It represents simply 1 point in time, but what it offers is something of a normative interpretation of what that number means. Is that a good number? Is it a bad number? Or is it something in between? And here again, we utilize some point of reference, all other counties in the state perhaps, compared to your own county, and we divide them into thirds, and we simply show who has perhaps the more serious problems versus the less serious problems. But this again is one that conveys a lot of information very quickly, and people do tend to like it. Scatter plots are very useful for summarizing a large variety of information. In this particular scatter plot, we see whether or not it's above or below a state average, and whether or not it's trending in a fashion that's improving the situation versus worsening. And here again, this simply summarizes a lot of information in simply one picture, and it's oftentimes nice as a culmination of reporting when we're looking at a situation within a community. This is a type of bubble chart that is actually adds yet a third dimension, and I suggest that it may be too much of a good thing, insofar as it not only shows the trends, good and bad, and above and below the state averages, but then it shows the relative size of the problem as well. I took this particular graphic home and showed my wife. She looked at it for about 3 seconds and said, "I'm not going to deal with that." And so once again, we need to kind of keep in mind the fact that individuals need to be able to grasp the essential point of any given graphic very, very quickly within a matter of seconds. And so with that brief sort of overview and summary of secondary data access as well as its graphical representation, we'll put a wrap on it for now. In our next video clip, we'll talk at somewhat greater length about continuing the discussion of community needs assessment and look at gathering primary data from within the community. And then thereafter, what we'll be talking about in our next sections in relation to community development will be assessing community preparedness as well as the notion of building community consensus in and around priorities. So with that, thank you very much for tuning in, and we'll look forward to visiting with you very soon. Finally, once again, here is the contact information for the principals behind the CAPE training program. You can see my contact information. You're more than welcome to contact me at any point in time to discuss any of this or to discuss any kind of community behavioral health initiative that you'd like to undertake within your community. You can also contact Mark Skidmore and, of course, Rosa Solas McKelvey at Michigan State University. So once again, thank you very much, and we'll see you soon. Bye-bye.